Do you ever feel so overwhelmed by all of the content out there that's telling you how to improve your mental health and feel better and be the best version of yourself? There's so many videos and blogs and articles. It can just be exhausting. Well, don't worry, you're not alone. I've got you. Over the past 10 years, I have been studying and practicing psychology, and I've learned a lot of different skills and concepts and strategies. And in this video, I'm going to teach you my favorite one. I'm Dr. Mary Kate Ruhan. I'm a licensed clinical psychologist and drama therapist, and I help emotionally sensitive people go from feeling overwhelmed to empowered. Just a quick reminder that this video is for educational purposes only. So if you need more support, please contact a licensed mental health provider in your area. Next skill I'm going to teach you today is called opposite action. It's from dialectical behavior therapy, or DBT for short. And essentially, what it does is it helps us to regulate our emotions. So here's the thing, emotions tell us how to behave. When we experience a feeling, it's going to give us some kind of urge or impulse to behave in some way. So, for example, if I'm feeling really, really sad, I tend to have the urge or the impulse to get under the covers and just withdraw from people. If I'm feeling really angry, I'm going to be more likely to want to kind of lash out and yell and get frustrated. If I'm feeling really, really ashamed or embarrassed, I tend to want to hide. So all of us have a certain behavior that our body and our mind tells us to do when we're experiencing a big feeling. Now, the thing is, when we do the behavior that our body is telling us to do, we tend to feel that emotion even more. So if I'm feeling sad and then I say, okay, you know what, that's it. I'm not going out with my friends. I'm just going to get under the covers. When I'm under the covers and I've ditched my friends, I tend to feel even more sad. And the skill opposite action helps us to change whatever unwanted feeling that we're having by doing the opposite of what the feeling tells us to do. I know it's kind of a confusing concept. Let me give an example. So, say that you're feeling really anxious. And maybe you're anxious because you have a big exam coming up. And every single time that you go to study for the exam, you feel anxious and your body just says, I don't want to. And you put your books and your computer away. Well, then you probably feel more anxious because now you're avoiding studying and your anxiety is building. So, what opposite action does is it tells us to pause and say, what's the emotion that I'm feeling that I don't really want to feel anymore? Oh, okay, anxiety. I'm feeling anxiety. What is anxiety telling me to do? Oh, it's telling me to just stop studying and go watch TV. Well, now I'm going to try to do the opposite. So instead of stopping my studying and completely avoiding it and watching TV and distracting myself, I'm going to say, okay, the opposite of that is to study and to try and focus. And even though it's so hard to do in the moment, to try and do the opposite of what our brain and our body is telling us to do, when we kind of override that impulse and say, all right, you know what? I'm going to study instead, it tends to decrease the intensity of that unwanted emotion. So I might start studying and then I feel a little bit less anxious once I'm in the groove of studying. So again, the best therapy skill that I've learned is opposite action. Asking myself, what is this unwanted emotion, this emotion that's not helping me, that's not making me feel good? What is it telling me to do? And then doing the complete opposite. And that is a way that you can actually start to regulate your emotions. I encourage you to give it a try and leave a comment and let me know how it goes. If you'd like to learn more therapy skills, feel free to click the link in the description and I'll send you a free guide on ways to navigate your emotions. Okay, see you soon.